Halo semuanya, saya Ira dari Lavender Medicare. Hari ini saya berada di Mount Elizabeth Novena bersama Dr. John Wang. Dr. John adalah seorang ahli bedah vaskular dari Singapura. Hi Dr. John, thank you for having us today.
Hi Ira, it's a pleasure to be here.
Yes,
Good to meet you.
Good to meet you too. Dr. John, can you share with us what does a vascular surgeon do actually?
Okay, so I'm a vascular and endovascular surgeon, and I operate on patients with blood vessel problems. Things like aneurysms in their aorta or their peripheral arteries, or blockages in their blood supply where they may need open surgical bypass or treatment with things like balloon angioplasty or stenting. I also treat people with vein problems such as varicose veins or chronic venous insufficiency.
Dr. John, I understand you also treat hypertension. I always thought that hypertension is managed by GPs, cardiologists, nephrologists, but not a vascular surgeon. So how do you actually manage high blood pressure?
Yeah, that's a very good question, and you're absolutely right. Most times, hypertension is managed by the medical specialist. But let's find out how I can help. Let's start with what's normal. Normal blood pressure is 120 over 80, yes. Top number 120, bottom number 80. The top range, systolic blood pressure, should be between 100 to 120. The bottom range, 60 to 80. Now, it used to be that high blood pressure is defined as 140 over 90. But more recently, in 2017, the ACC, American College of Cardiology, and AHA, American Heart Association, redefined the criteria to be 130 over 80 millimeters mercury. That's important for diagnostic criteria and also for treatment goals.
So that means after 130, you are given medication to manage the blood pressure.
If the patient's blood pressure is persistently above 130 over 80, they are termed to be hypertensive, and they should seek treatment to start medical therapy to bring their blood pressure down to the more normal range, below 130 over 80.
So what are the treatments available to treat high blood pressure or hypertension?
Usually hypertension cannot be cured unless it's due to an underlying condition. For example, if patients have an adrenal gland tumor or renal artery stenosis where the blood supply to the kidney organs themselves are narrowed and there's not enough blood getting into the kidneys. Those are the underlying causes. And if you treat the underlying cause, for example, the adrenal gland tumor, if they undergo surgical resection, then you can definitively cure the blood pressure. Or if you treat the kidney artery stenosis, then the blood pressure can go away. However, most times, fortunately, we are able to manage high blood pressure, mainly with agents that we call antihypertensives, and these are medications. And the approach would be to start the patient on one medication and increase the dose to effect, meaning to bring the blood pressure down to what is more acceptable, which is 130 over 80 millimeters mercury. If one agent is not enough, then we will add a second agent, and same thing, we will increase the dosage. Some patients will need a third, a fourth, maybe even a fifth agent. Wow. Yes. And this is where a vascular surgeon may be able to help because we can offer this novel therapy called renal denervation, which can help mitigate or bring down the blood pressure effectively, and also maybe even reduce the number of medications that they need.
You mentioned you will have to take one or up to more than 4 medications to bring down the high blood pressure. But is it all right to take so many medications?
Well, it's a matter of necessity, but most medications, they do have side effects. And not only that, once you have many medications on, which is what we call polypharmacy, time and time again, it's been shown that it can lead to confusion and also poor compliance. A combination of undesirable side effects and also low compliance to these medications, what it really means is that the blood pressure is not well controlled. And if the blood pressure is not well controlled and the treatment goals are not achieved, then we do a poor job of preventing complications of hypertension, things like heart attack, heart failure, stroke, kidney failure, and also peripheral arterial disease. Now, these complications, if they do occur, can be debilitating to the patients, sometimes even fatal. And if they do happen, for sure it will add on to the healthcare costs to the patient which they have to bear.
You mentioned just now that RDN will be able to help manage this high blood pressure. How does it work?
So RDN is a minimally invasive therapy, what we call endovascular therapy. And it's very much like a coronary angiogram or a heart cath, where the renal arteries or the kidney arteries are accessed by vascular surgeons like myself. And we use a very specialized catheter to deliver very accurate amounts of radio frequency energy to disrupt some of the nerves that surround the renal arteries, called the sympathetic nerve network. Now, this nerve network, the sympathetics, they usually work in conjunction with the heart, the carotid arteries, and the brain to regulate blood pressure. So disrupting these nerves with RDN can bring down the pressure 5 to 10 points in a sustained fashion. Now, this RDN therapy is relatively new in Southeast Asia, and it is a minimally invasive procedure.
What are the risks of this procedure?
Like any procedures involving catheters and wires, what we term endovascular surgery, the main risk is bleeding, because we do have to puncture an artery to gain access to be able to deliver the catheter and the therapy. For most parts, it's very well tolerated and has very little pain. Most times we treat the patients under sedation so they're comfortable. They don't even feel the therapy.
So what are the criteria for a patient that can receive this treatment?
Mostly it's for a subset of patients that we term refractory in hypertension. So these patients usually are already on at least 3 medications. That's the primary criteria. But to determine whether the patients are proper candidates or appropriate candidates for this type of therapy, I need to assess them thoroughly and also explain what the treatment criteria are.
So if I'm not mistaken, that means this RDN will be able to bring down the high blood pressure of a patient and possibly reducing the medication that they need to take.
That's correct. So the RDN trials have shown that we could bring the blood pressure down by 5 to 10 points in a sustained fashion, 24 hours a day, 7 days a week, and even beyond that. And in some cases, we are able to reduce the types of medications that the patients may be on, which will help in terms of compliance. Because a lot of our patients are older folks in their 70s, 80s, and 90s, and they have a lot of trouble in terms of compliance, not because they don't mean to take their medications, but they get confused.
Yeah, too many medication. You have to remember all those.
Yes, and the reality of it is that 30 to 40% of patients overall globally have poor compliance for these reasons, either because they get confused, they can't remember to take them, or the side effects are not desirable, or we even have issues with affordability, because some of these medications can be expensive.
Thank you for your explanation, Dr. John. I believe many people have hypertension, and it's very good to know that there's an alternative treatment to manage their blood pressure.
You're most welcome, Ira, and thank you for the opportunity to explain that we are offering this novel therapy. It's relatively new in Southeast Asia, and above all, it is minimally invasive, so the patient downtime is minimal. And because it's relatively new in Southeast Asia, and we do provide it here at Pan Asia, do call our clinic so that we can assess to see if the patients are appropriate candidates.